Good morning, good afternoon, good evening. Thank you for joining our webinar on addressing cervical cancer through the Global Fund, part of Together for Health Spring 2020 webinar series. I'm Selena Schocken, Executive Director of Together for Health. I would also like to thank our webinar co-sponsor today, Friends of the Global Fight, which leads U.S. advocacy for the Global Fund. Since 2002, the Global Fund to Fight AIDS, Tuberculosis, and Malaria has saved millions of lives. A key area of investment is HIV prevention and treatment. In 2018, 18.9 million people were on antiretroviral therapy in Global Fund-supported countries. The Global Fund recognizes that too often, lives saved from HIV are lost to preventable disease, like cervical cancer. Women living with HIV are 5 to 6 times more likely to develop cervical cancer than their HIV-negative peers. The Global Fund has been a real leader in recognizing the impact of cervical cancer on women living with HIV and encouraging countries to fund cervical cancer prevention through their programs. As many of you know, Global Fund funding is country-led, so countries determine their funding priorities. Together for Health, alongside our partners, developed a series of guidance briefs to help countries understand how to set up or scale up cervical cancer prevention. We will talk about those briefs a bit later in the call. Today, we're going to hear from some excellent speakers about how the Global Fund supports efforts to integrate cervical cancer prevention in its HIV portfolio. I want to quickly mention a few logistics. All attendees are on mute during the call, and you can ask questions through the Q&A box, which is at the bottom of your screen. We will take questions after each presentation if time allows, or at the end of the event. This webinar is being recorded, and it will be available on our website after the event. So now I'm going to introduce the first of our 3 excellent speakers, and that's Dr. Nicholas Furtado. He's going to speak about Global Fund support for HPV and cervical cancer. Dr. Furtado is an advisor in resilient and sustainable systems for health at the Global Fund, with a focus on reproductive, maternal, newborn, child, and adolescent health. Dr. Furtado has over 20 years of experience in service delivery, policy development, and multi-stakeholder collaborations in varied health systems, including challenging operating environments, low-income and high-income countries. Dr. Furtado?
Thank you, Selena, for this opportunity to speak on this really very critical webinar. Can you hear me?
Yes.
Yeah, thanks. So I'll just go ahead, I think, with the presentation, and I hope this is of use to our audience. So going to the next slide. As everyone knows, our strategy, the Global Fund strategy, is really geared up. The strategy from 2017 to 2022 is geared up to offer potential to reach more women for screening and treatment of HPV through HIV programming, as well as interventions to strengthen health systems and foster improved gender equality. And that is reflected in 4 of the main objectives: maximizing impact, building resilient, sustainable systems for health, promoting human rights and gender equality, and of course, mobilizing increased resources. And all these 4 objectives are synergistic and represent a comprehensive strategy of investing to end epidemics. Next slide, please. Could we go to the next slide? The next slide focuses on one of the key pillars, that is building resilient and sustainable systems for health. This strategic objective is really critical because, similarly to promoting maximizing impact on the 3 diseases, building health systems, and we will come to this throughout the presentation of how we can integrate interventions that address HPV and cervical cancer through building health systems and resilient health systems for health. Of this particular objective, we have critical support that we can provide, especially to women, children, and adolescents, through platforms of integrated service delivery. And this piece is critical because one of the key issues that we find is that women come for service delivery but do not receive integrated care, which includes HPV and cervical cancer prevention and screening. Can we go to the next slide? So another pillar which is critical to the fight against cervical cancer and HPV is promoting systems that actually address issues of human rights and gender equality. And in this, we see there are several sub-objectives, but the Global Fund is really striving to scale up programs to support women and girls, including programs to advance sexual and reproductive health and rights. And the next sub-objective, to reduce health inequities, including gender and age-related disparities. And to this end, the next slide, please. In 2015, can we have the next slide, please? In 2015, the board of the Global Fund adopted the strategy, which the framework policy on co-infections and comorbidities, which allowed new technologies that are introduced, and as countries consider broader health needs beyond HIV, TB, and malaria, we expected an increase in country requests for financing new health interventions that address the burden of the disease and their co-infections. And critical under this policy is that all these interventions that are addressed through co-infections and comorbidities, including HPV and cervical cancer, they should be based on a strong investment case that consider impact and cost within the context of existing programs, extends the life expectancy and prevents or reduces mortality and morbidity of people with HIV, TB, and malaria, and is an effective health intervention. And therefore, the evidence that we have on HIV and cervical cancer prevention that is coming up can be used to scale up programs in countries through Global Fund grants. And critically, it should be aligned with national policies. And for HPV and cervical cancer, this means that this can facilitate the access to screening, early treatment of cervical cancer for women living with HIV, and for those who are not just living with HIV, but can be exposed to HIV through increased infection bidirectionally. Can we have the next slide, please? The next few slides, I'm going to go through simple examples of how in the last 2 cycles, we did a rough analysis of what the Global Fund has funded. And you can see in this slide, there are very broad kind of buckets that indicate how countries have actually invested through their HIV and HIV grants in interventions that actually address HPV and cervical cancer. And you can see here one of the main buckets is investments. About 30% is investments in labs and consumables. About 37% is in training. So training healthcare providers in screening and treatment of cervical cancer, early cervical cancer, and referral. And also, very interestingly, service delivery and policy guidelines and surveillance activities that relate to HPV and cervical cancer. And although the total investments are modest, you can see that countries are very interested, and they have been integrating interventions for HPV and cervical cancer treatment and prevention within their Global Fund grants. In going to the next slide, please. You can see here some of the key interventions that were funded in the past cycles, and this gives a little bit more granularity of what countries have been asking for. You can see everything from HPV prevalence studies, integrated surveillance systems include cervical cancer, and addressing policy documents that link HIV, STIs, other maternal and childhood services along with cervical cancer. And then on the upstream, demand generation through civil service society organizations, promoting the demand and creation for cervical cancer screening, and in the broader context of HIV and sexual and reproductive health services, including cervical cancer in the messaging, screening tools, in the mentorship and demand generation for integrated services, including cervical cancer. Next slide, please. Could I go to the next slide? Then you can see here some of the large buckets in training. And training, we can see in-service training of doctors and nurses in integrated cervical cancer screening at ARV sites. But much of this training also reflects on the general services for women accessing sexual and reproductive health services across the board, not only for HIV programs. And you can see this involves integrated training, refresher training, training cascades, training for camps, for outreach services, training of service providers and their supervision. And you'll find this theme of integration coming up a lot in our funding requests, where in our ART clinics, you see countries requesting integration of cervical cancer in family planning clinics, referral hospitals, strengthening the linkages between RMNCH and HIV by supporting operationalization of the national guidelines for HIV and RMNCH, and integration of family planning and cervical cancer screening and treatment programs with HIV. And very interestingly, some innovations in ICT approaches to actually screening for cervical cancer, monitoring visits, supervision, and demand generation. Next slide, please. One of the things I wanted to talk about in the next part of the presentation is how the Global Fund funding cycle works. And this is just to outline where in the cycle we have opportunities to integrate cervical cancer screening and prevention. And you can see the cycle is, we have a 3-year funding cycle, and we have an application process of about 6 to 9 months. And before the funding cycle and the application process starts, it's critical to have national strategies that support the interventions that you're going to include within the funding request. So as a basis, that would be a important point for technical partners, for in-country stakeholders to ensure that when national planning occurs, there are interventions, evidence-based guidelines and interventions that actually support the funding request and enable the funding request to include interventions for HPV and cervical cancer prevention and treatment. The funding request involves a country dialogue which is going on throughout the funding cycle. But during the country dialogue, it is important for those who are stakeholders in RMNCH and in cervical cancer interventions to actually be available and present to influence the dialogue and ensure that we have the right interventions in the funding request. And not only that, throughout grant implementation, it's critical to have experts, technical partners to ensure that even when the funding request has included a piece for cervical cancer, this is implemented properly, and it has the right support from the other parts of the health system to ensure that these investments are actually properly used in the country. Let's go to the next slide, please. So this next slide is a small snapshot of how some of the tools that we have sent out to countries with the application, with the allocation letter, and with all the application materials shows the entry points across what we call the modular framework, where we look at different modules for HIV prevention, HIV treatment, care and support, and for health systems, and have amplified the entry points for cervical cancer and HPV. And this is part of a document that's available on the Global Fund Access to Funding website, and all technical partners, all stakeholders in this fight for elimination of cervical cancer can actually access and advise countries on how to integrate some of the key interventions into their funding requests. And as you can see here, the main entry points are through sexual and reproductive health services, where screening for cervical cancer and HPV can be integrated, both in those for key populations, for adolescent girls and young women. In HIV treatment, care and support, all people living with HIV can make use of screening and support to integrate the vaccine for human papillomavirus into interventions that strengthen and prevent and manage co-infections and comorbidities. And under health systems, you can see that we have ensured that you can integrate interventions for HPV and cervical cancer prevention within broader integrated service, people-centered health services for RMNCH, GBV, other services, and within health facilities and community-based organizations. Next slide, please. And moving on, I just wanted to say what are the key opportunities for engagement at country level for the new funding cycle. As I said before, one of the key points of entry is to ensure that national plans for HPV and cervical cancer are updated and have the latest interventions that can be discussed while the funding requests are being put together. And during this process, all the advocate stakeholders need to discuss the opportunities and challenges and input this into the planning process to ensure that they're adequately addressed in the plan and in the funding request. The second point is that many countries could request and could benefit from technical assistance and programmatic guidance. And this will ensure that the right kind of interventions that will pass through our technical review panel ensure that cervical cancer and HPV interventions are part of the ongoing country dialogue and for preparing the Global Fund requests. And lastly, all stakeholders who are important for this process need to be involved. Technical partners, experts, women living with HIV, adolescents living with or affected by HIV, TB, and malaria, they should be part of the dialogue process and should be involved with CCM to ensure that all these perspectives are taken into consideration as the priority interventions are included into the funding request. And this is a broad outline of what we would suggest and how we are trying to support the fight against cervical cancer and HPV globally. Thank you.
I apologize, I was on mute. So I wanted to thank Nick very much for a great presentation. And now I want to move on to Dr. Medhin Tsehaiu to talk about global fund support for screening and treatment of cervical cancer in Zambia. Dr. Medhin Tsehaiu is the UNAIDS country director. From 2014 to 2019, she served as the country director in Zambia. In this role, she represented multilateral institutions in the Global Fund country coordinating mechanism and provided strategic leadership and assistance to the development of 2 rounds of Global Fund grant applications, mobilizing over $500 million to fight HIV, TB, and malaria. Dr. Medhin has also served as the UNAIDS country director in South Sudan and as chief of staff of the Federal Ministry of Health in Ethiopia. Dr. Medhin?
Thank you so much for the introduction. Yeah, I will be sharing the experience that I had in Zambia, how Global Fund supported the cervical cancer programming. Next slide, please. So this is an overview for those of you who are not familiar about the HIV epidemic in Zambia. So Zambia is one of the top 10 countries with the highest burden of the epidemic. You can see that there are about 1.2 million people living with HIV, and then the prevalence, the most recent FIA, the population-based HIV impact assessment, is about 14, yeah, so the national average is 12, but when we see the disparity between male and female, you can see that women are highly affected by the disease. Looking at the new infection, there are about 43,000 new infections happening annually. The AIDS-related deaths, about 20,000. So if we look at the young population, especially between the age 20 to 24, you can see that adolescent girls and young women in this age range are 4 times higher affected by new infection compared to their male counterparts in the same age range. And when we look at the total infection, where the new infection is coming from, mainly it is between the 15 and 24 years old young. Looking at some of the related contributing factors, child marriage is at its highest, about 42%. Then when we look at the teenage pregnancy, about 28% of adolescents have been pregnant or given birth under the age of 18. And then looking at the unsafe abortions, about 60% that lead to complications on morbidity or mortality. And then when we look at the cervical cancer incidence rate, it's 58 per 100,000. So this is just an overview so that we can dive into now the programming. Next slide, please. So this slide, the theme could be a little bit of a challenge. So it's on one hand showing, the partnership that we have had, and also through advocacy, how we were able to generate, the political commitment from the highest level up to the program leaders. So this is again indicating that Zambia is among the top 10 countries in Africa with high incidence of cervical cancer, as we have seen in the previous slide. And a third of all new cancer cases basically account for cancer cases. And when we see the women living with HIV are from studies shows that they are 4 to 6 times at risk of developing cervical cancer. So how did it start in Zambia? So the former First Lady, Dr. Christine Kaseba, was partnering with Pink Ribbon and Red Ribbon, and probably just to make sure that all of us are familiar, UNAIDS was one of the founding member organization to with this initiative of, in short, the PRR that we call it, with the Bush Institute, PEPFAR, Susan Komen, and many other private sector. So with this partnership, there was already an initiative that was introduced to screen and treat early cervical cancer program in Zambia. And the former First Lady was having a mobile clinic to do an outreach for screening of cervical cancer, which was not very much known. So that has, in a way, introduced some level of awareness. Again, through this partnership, meaning through the Pink Ribbon, Red Ribbon, Zambia was among the 8 countries in the region that was supported to demonstrate the screening and treatment of cervical cancer, targeting women aged 25 to 59, and mostly targeting women living with HIV. And this initiative also provided a limited number of vaccines, the HPV vaccine, targeting young girls between the age 9 to 14. So this was like a demonstration. So even if the vaccines were available, because there was a perception by the community that this is meant to make the young girls to reduce the fertility. So there was a lot of resistance because there hasn't been enough awareness raising done, and the acceptance rate was very minimal. But through concerted efforts, of course, the uptake was much better at a later stage. So as UNAIDS, because we're part of the PRR, and this initiative used to have a monthly regular teleconference with the Ministry of Health, with civil society on board to really see how are we moving in terms of demand generation and also scaling up the services. Through this effort, at least we were able to mobilize the commitment of the incumbent First Lady, Mrs. Esther Lungu, to prioritize. When she assumed office in 2016, then she made the prevention and control of cervical cancer as one of her priorities among other areas in her strategic engagement in the social sector. But prior to this, probably it's in the next slide, but I must mention that through the PRR initiative, there was a lot of effort to encourage the Ministry of Health to develop the national strategic plan on cancer control and treatment. Unfortunately, with the support from all of us, including UNAIDS, this strategic plan was developed and launched in 2016. So this relates basically to the previous presentation, that indeed we need to have a proper strategic plan if we want to consider in the global fund application, but also domestic resource mobilization so that services can be scaled up. So having done this, the National Health Strategic Plan also embraced the cancer control and treatment program now, which has become indeed an integrated plan or national plan, even in the health sector development plan. Of course, having the basic strategic plan on the cancer itself. So with this, now the leadership in the Ministry of Health was very much committed, first of all, to appoint a national coordinator, which was not the case before. So this has indeed facilitated to have a systematic institutional commitment, and also formalizing the technical working groups that brought on board various partners, including various groups of civil society, and mainly women working on advocacy, awareness raising, and technical support from the NGOs, some like the implementing partners of PEPFAR. So with this, on one hand, it indeed increased the demand generation. Basically, it facilitated demand generation because it also related to a number of awareness raising through the treatment literacy. And through that, the ministry was able to develop now the guideline for testing, cervical cancer screening, and integrating into the ART programs. Next slide. Yeah, so how did we now manage to incorporate it into the global fund funding request? So Zambia submitted the new funding model. That time it was called the new funding model because Global Fund was transitioning from the round-based application into the new funding model. And as part of the application, the HIV TB, as part of the HIV TB proposal, there was an inclusion or a request made for scaling up the screening and treatment of cervical cancer. But when the grant was reviewed and when it came to the grant making, unfortunately, it was not approved. So myself, I was representing the multilaterals in the CCM throughout my time in Zambia, meaning the 5 years. So we were looking at how else can we mobilize resources. So one, as I said, from other partners, including PEPFAR, but also from the government. So that was going on. But in the process of implementing the new funding model, now there was a currency devaluation and there was, like in quotation, savings made in the grant. And that was the opportunity now to reprogram the savings made into some of the programs, the top priority programs where there was a funding gap. So that gave us an opportunity to indeed prioritize cervical cancer programming, and about $500,000 was allocated in 2017. And this was mainly meant for, again, awareness raising, capacity development of healthcare providers, and integrating screening services mainly into the ART clinics. So the advocacy, the PMU is meant by basically a project management unit of the Global Fund within the Ministry of Health. So with the strong advocacy and the technically sound proposal that we already have, and with the endorsement of the CCM, so it was led to the allocation of this $500,000 as an initial seed money. So this has now opened up an opportunity to indeed set up clinics in the different districts where there are ART clinics. And as UNAIDS, we also provided technical support on how to expand or scale up the services. So I think this basically facilitated, I can say now, that in the next funding request, which was from 2018 to 2020, again, myself sitting in the CCM, we critically followed up and then made sure that the cervical cancer programming was indeed now prioritized and identified to have a proper allocation of the resource. So out of the 194 million allocated for the joint HIV/TB allocation, so 1.4 million was now allocated for cervical cancer programming. And now that has enabled the national program to indeed scale up, but in the meantime also work on the expansion of or upgrading of the HPV vaccination. So the Global Fund was not meant to procure vaccines, and that was mainly the responsibility of the ministry, negotiating with Gavi to make the vaccination as part of the routine program. But because the services have been scaled up using now this 1.4 million, I think that also facilitated how the ministry negotiated and allocated additional resources from government resources to procure vaccine. That is what basically facilitated now to make it as part of the routine immunization. So as I said, civil society, they have really played a significant role in terms of the advocacy, in terms of the demand generation, but also the awareness raising. Next slide, please. Yeah, so this is basically a map of Zambia that I borrowed from the ministry to look like, how they were really able to expand or scale up the services in the various ART facilities, which means now it's indeed progressing very well to provide, the subjective, the VIA, and then those who need referral to do the LEAP screening and treatment services, they are referred to a higher level, but mainly the services are based on focusing on nurses with the task shifting that Zambia has introduced. So nurses are mainly the ones providing these services in ART clinics. Next, please. Yeah, I think in terms of achievement, again, these are the number of clinics that are currently providing the screening and treatment services, depending on the case, as I said, and the number of districts that we saw in the previous slide on the map. Currently, over 500 health workers have been trained, one nurse per ART clinic, to ensure that, yes, the screening is done, whatever treatment is possible, at the clinic level, but if there is need to make a referral linkage, then they make sure that that is also ensured as per the guideline that I talked about earlier. The HPV vaccine has now been integrated into the National Routine Immunization Program. And the information I received recently is that the first cohort of about 252,000 girls in that age range, 9 to 14, have received the first dose of vaccine. And then on indicators, there is an ongoing discussion on how to capture program-related cervical cancer so that implementation can be monitored and it can be disaggregated basically by age. Next, please. Yeah, so I think some of the gaps that were seen are the weak linkage, basically, from screening to treatment, especially those who need a further treatment, and also the data management, because it's important that we have proper registry. So if it is separate and not integrated into the DHIS or the HMIS, then it is very difficult to track or monitor the progress. So there has been an ongoing discussion. I'm sure they must have made a headway in terms of integrating into the national HMIS system, but also because the country is vast, the inadequate transport at national and provincial level, of course, was also a challenge. In fact, the Global Fund, part of the support was to procure vehicle to make sure that the transport is facilitated. But also, yes, we said in the 75 districts that they identified nurses to be trained, but again, that is something that needs to be strengthened. And finally, the next slide, please. Yeah, so the monitoring and evaluation, I think the research aspect also, I touched on it a bit. So one, the medical record. So in Zambia, they have what you call the smart care in the ART clinics. Even that one is not in all the clinics. I think that is one thing that they were trying to upgrade, and also include the cancer registry within the smart care, so that there is a clear linkage between the two, and rolling out of the smart care, obviously, to all the screening centers, and maintenance of the registry. Then on monitoring and evaluation and research, one is to provide supportive supervision on how it is happening, including the HPV vaccination among the adolescents, because we talked about the 9 to 14, and especially living with those living with HIV, and feasibility assessment on effectiveness of HPV. So that is also part of the research that has been going on with the support from the Global Fund. Next. Yeah, so sorry, I must have missed in one of the slides. I think all this effort has also catalyzed that now PEPFAR has allocated for the first time as part of the COP18 about $3.5 million to scale up the cancer screening and treatment program. And I'm sure even in COP19, this has been the case, but at least for the first time, PEPFAR was also able to allocate, recognizing that indeed this should be part of the overall achieving epidemic control agenda. And I believe this is really a great partnership from PEPFAR as well to complement.
Thank you so much, Dr. Medhin. We're starting to run a little short on time, but really thank you very much for an excellent presentation. I want to move now to Dr. Mary Rose Giattas. She is a Senior Technical Advisor for Reproductive Health and Cervical Cancer Prevention with Jhpiego, Tanzania, under the US-led Maternal and Child Survival Program, and she's the Manager for HPV vaccination and breast cancer programs. She's a medical doctor and a public health professional. She also holds a Master's of Public Health. Her primary areas of expertise are reproductive cancer and HIV/AIDS. Mary Rose. Mary Rose.
Hello.
Yes.
Can you hear me now?
Yes, please go.
Okay, okay. Thank you so much, Selena, for this opportunity to share what we have done in Tanzania. Good morning and good afternoon for people from elsewhere. So I'll just share a little bit of experience from Tanzania, what Global Fund of PEPFAR have contributed, with specific focus on cervical cancer prevention and control. And it will not only reflect PEPFAR or Global Fund, but also additional contribution from other partners. Next slide, please. So the outline of my presentation will focus on a little bit on the background and status of implementation, where we are. Next slide. So I'm sure you all know this slide, and I just wanted you to know that Tanzania is also aligning with the global evidence and WHO recommendation in cervical cancer prevention control is concerned, with specific focus on primary, secondary, and tertiary prevention components. And whatever is being specified in each element, we are trying our level best to make sure that it's scalable and move from the regional level to the dispensary level. Next slide. So a little bit of what is Tanzania, what we have in terms of demographic characteristics. So we have a national cervical cancer prevention control program, which is led under the reproductive and child health section, and it was launched way back in 2008. And what you can see, we have more than 27 regions, and unfortunately more than 71% of the population live in rural areas, and our HIV prevalence generally is 5.3%, and we have a lot of health facilities. We have 8,215 facilities that includes districts, regional, as well as health center and dispensary level. And the goal of our national program is just to reduce incidence, morbidity, and mortality of cervical cancer. We really want our women to be free from the body. Next slide. So I just wanted you to compare and contrast what is happening when the incidence rate and mortality rate is concerned in Tanzania and other countries in Eastern Africa. So you can see Tanzania is actually having the highest incidence rate and the mortality rate when compared with Burundi, Uganda, Kenya, as well as Rwanda. So 59 versus 42. So the message is more than 50% of the women who are diagnosed with cervical cancer, they end up dying. Next slide. So we are also aligning with the Sustainable Development Goal 3 as well as 17 in order to ensure a healthy life for people in Tanzania, and SDG 17, which also reinforce the importance of partnership. So you can really see from my presentation the role of partnership in scaling up cervical cancer prevention program in Tanzania. So a little bit about Jhpiego. Jhpiego have been working with Tanzania since 2008 with great support from USAID PEPFAR Global Fund, and supporting the ministry activities at national, regional, as well as district level services. Next slide. So we are also aligning with our current global elimination agenda when cervical cancer control is concerned. So the 90, 70, 90 targets. We have a national strategic plan, and we are also developing an operational plan that aligns with 90, 70, 90, assuming and hoping for the best. So by 2030, we'll be able to have 90% of our fully vaccinated children in Tanzania, adolescent girls, and 70% of the women being screened, and as well as 90% of the women who will be diagnosed with cervical cancer being managed according to whatever protocol we have. Next slide. So this is just a snapshot of the elements and pillars of our strategic plan. As said earlier, it aligns with the global WHO cervical cancer prevention control strategies. That means it unpacks the primary, secondary, and tertiary prevention services with great strengthening specifically on the monitoring and evaluation piece, and also health system strengthening, also a little bit on demand creation, making sure that community understands and actually they come in to be screened and treated when they have this cervical cancer lesion. So we just updated our strategic plan, and now we have updated, and we have 2019-2023 recently updated strategic plan, which focuses on those three pillars which I've just mentioned. Next slide. So in terms of service delivery on the secondary prevention component, again, I think it's similar to other countries in Africa. And our main national strategy is screening and treatment, immediate treatment, but using VIA, but we also promote pap smear as well as HIV DNA testing. Although the country, together with most of the partners that are supporting the country, including the PEPFAR support by itself, actually promotes VIA because we have managed to increase the coverage significantly because of its cost effectiveness. And most of our services are being offered in reproductive and child health clinic as well as in HIV clinic. And we offer education as well as cervical cancer screening with immediate treatment with cryotherapy as well as thermocoagulation in few facilities. And we also integrated breast cancer screening and HIV testing. More than leakage and referral for all those patients which are being diagnosed or suspected to have cervical cancer. So our target age group is 30 to 50, and we don't segregate HIV positive versus negative anymore. However, although we get bigger funding from PEPFAR, we make sure that most of the HIV positive women are being screened. And we also strengthen the referral sites with specific focus on biopsy component as well as lip services. And the breast cancer piece, we also make sure that women who really need to get mammography, that mammography is done in the tertiary care level facilities. And we also have cancer centers as well as referral hospitals that can also offer surgical, chemo, as well as radiotherapy services. So in terms of coverage, we have managed to introduce the services, spreading it to the services at regional hospitals, most of the district hospitals, few health centers, and very, very few dispensaries. Next slide. So this slide is really very, very important. So you can see a lot of partners and donors who have contributed to see what you're seeing in terms of implementation status. Global Fund in particular, through PEPFAR, has done a lot through HIV partners, including Jhpiego. And when you look at the status for primary prevention, we have introduced the vaccination national program since April 2018 in all 30 regions. And on the secondary prevention component, we have more than 624 cervical cancer screening sites, and among them 30 orphanage services. And we have trainers, we have built capacity of trainers, 40 of them, and more than 3,000 healthcare providers being trained on PIE as well as sclerotherapy. And we have also managed to develop different multiple technical documents to guide effective implementation of the program. And more than 1.2 million women have already been screened. And I could say 30%, 25 to 30% are HIV positive population. So we also have Ocean Road Cancer Institute, 2 centers, Ocean Road and Bugando, that offer comprehensive cancer prevention, cancer control interventions that include radiotherapy and chemotherapy. And countrywide, we have more than 30 oncologists. And so actually, most of them are in Ocean Road, and 9 of them are at the Bugando Medical Center. So we also have guidelines on breast cancer being supported by Susan G. Komen, and we also have a training package for that. And we're also trying a little bit to integrate the prostate cancer component. So in this particular slide, I really wanted you to see how many implementing partners and actually donors who really contributed to see what you see as results, including Global Fund and PEPFAR as well. Next slide. Next slide. So this slide shows exactly the coverage. So I told you earlier that we have HPV vaccination program countrywide and in all more than 8,000 facilities of HPV vaccination services. And when you look, this is just the data from January to September 2019. So when you look at the coverage for the dose 1 is 85%, which is not really very bad, but we are not really doing very well on the second dose. So we still have some hiccups on the second dose when you look at the initial coverage of 44%. So we are trying our level best to push this button up to make sure that we increase the coverage of the second dose to more or less than 80%. Next slide. So in our strategic plan, we actually scrutinize and discuss critically on what really targets we can have for the first year of the operational plan. So you can see the targets based on the primary, secondary, as well as tertiary component, and probably with time, assuming by 2020, we are going to reach 90, 70, and 90. So we have specific targets for vaccination coverage, specific target for screening, and then specific targets for tertiary components. So I wanted you to know that in our guidelines, we have unpacked and customized this in our local context. Next slide. So in terms of challenges, I'm sure these challenges are similar to all the other challenges which have been experienced in other African countries. So we still have the mortality rate is still high. More than 50% of the women who are diagnosed with cervical cancer really die. And then we still get late presentation of disease. The coverage of cervical cancer screening and treatment services is still very low, less than 20%. And we still have issues in our managers who are responsible to supervise the program at region district level. We really need capacity building to make sure that they run quality focused programs. And when you look at the human resource for health, we still have shortage of skilled healthcare providers that really know how to screen and treat effectively, although we have done a little bit good work at the HPV vaccination side. And then we also have issues on supplies and HMIS, specifically in data quality assessment. And then the referral system component, especially for suspect cervical cancer cases linked with pathology services, is still an issue in the country. And then quality improvement, we have guidelines that focus on VIA quality improvement, and we have standards for that. But still, because of the limited funding, existing trainers are not really very many. One, two, the managers themselves, not many of them can really use the quality improvement tool to make sure that it's well standardized in all the regions in Tanzania. So we also have issues on repair maintenance of the cryotherapy as well as sleep machines. We have few technicians who have been trained to do that. And then we also have issues on scaling up and sustainability of the program, because most of the sites which I've just mentioned have actually been established by donors in collaboration with the implementing country in the country. Next slide. So in terms of existing opportunity, our country is blessed for the past 16 years to receive paper support and to improve access to not only ART but also BMMC, and also expanding cervical cancer prevention services, and also making sure that systems are being strengthened effectively and efficiently to meet sustainable services for HIV population, but also for women who are actually suspected to have cervical cancer in order to reduce mortality as well. But for this year, our country submitted a global fund proposal, and according to the Ministry of Health, we have already received some funding to support quality improvement issues as well as community peace through THPS. But discussions are really underway with current agencies, USAID as well as CDC, and probably by next week we'll be able to know exactly how existing paper funding will be reallocated to existing partners. So in this particular piece, in terms of where we are for this 2020, can I please not say much until probably after next week, but I'm sure we'll get something to support the ministry at national level and regional level, including strengthening existing sites. Next slide. So I really wanted you to know country priorities, especially the Global Fund crew, so that as support is coming in, it's very, very important to align with what the really ministry recommends in terms of moving forward. So we are thinking of, okay, fine, one, we still have issues in expansion. Our coverage is low, so we really need to do more in terms of scaling up. And then because of quality of the services, we still want to strengthen existing sites, making sure that they're strong enough and robust to offer quality focused services. And then we need to procure some equipment and supplies, specifically treatment equipment. And we are moving forward with thermocoagulation because Jhpiego supported the ministry at least to introduce thermocoagulation treatment in few sites, and they're working very, very well, and we recognize it's a cost-effective intervention. And then capacity building of additional trainers and healthcare providers, and then also we need to work a little bit more on increasing public awareness, because in the rural area awareness is still low. And we're also thinking of introducing HIV DNA testing, specifically the regional referral hospitals. We were supported by WHO in few demonstration sites, but we really wish to have at least all the regional hospitals being able to offer HIV DNA tests, respectively, linked with treatment of pre-cancer patients. So the QI is a very, very important piece too. Next slide. Additional priorities, we still have to work a little bit more on the referral system, tracking and making sure the feedback mechanism really works for suspect cervical cancer cases and for large lesions. Although we have been able to establish LIP services at regional level, but still, clients who are diagnosed with large lesions in the lower facilities, it's very challenging for them to reach the regional referral hospital. So thinking of probably expanding LIP services to the district level facilities. So pathology has also been a big issue. We still need to work on it. And then repair and maintenance of cryotherapy and LIP machines. We need to add more technicians and making sure that we have a sustainable system when maintenance and repair is concerned. And then we also think of strengthening the amenities at the HMI by doing regular data quality assessment and making sure that our managers as well as healthcare providers can use their own data for decision making and also for improving program performance. Sustainability is a big outcry. So we are working on it, but the government is trying the level best. And for example, now based on our financing mechanism, facilities are responsible to plan and put the budget line. So we're expecting to have budget line for this at the facility level. Next slide. So these are just quick photos. Please spectra, you can move them fast. So how Jhpiego has been able to support the ministry. So training, capacity building at different levels of the healthcare system, including technicians. Next. So we also worked a little bit on supporting the Ministry of HMIS piece as well, making sure that we have a system in place, we have indicators in the system, and also supplies and equipment component, making sure that all the sites that are being supported, they also have sufficient supplies to make sure they run quality programs. So in conclusion, success factors are: one, ministry commitment, ownership, and partnership has shown significant difference when scaling up and is concerned in Tanzania. PEPFAR in particular, Global Fund in particular, really acknowledge the contribution a lot. And then training, quality improvement, different and repair systems, strengthening is key. And then using data for improving program performance is also very, very important. And we really need to work on sustainability issues. So in order to be more impactful, we really need to maximize on the coverage and quality rather than thinking of the number of screening tests which needs to be done. Next slide. I just wanted to, next slide, to acknowledge everybody who have contributed in Tanzania. Thank you very much for your attention.
Thank you so much, Mary Rose, for going through a number of really excellent slides very quickly. We appreciate it. Quickly, if just people, if you have questions, you can write them in the Q&A box. If I could have the next slide, please. I just wanted to tell you about the Global Fund briefs that we wrote. There are 5 briefs that have basic information about how countries can get cervical cancer funding from the Global Fund and how they can work with their CCMs to do that. They're for any country or organization interested in cervical cancer. Next slide. There are 5 briefs, which is an overview of cervical cancer and HPV vaccination, screening for HPV and cervical cancer, treatment, and then also ways of mobilizing the community, doing advocacy, and engaging with networks. They're very short briefs, and what they do is have links to WHO guidance documents and other documents. The next slide. And you can use these to help your country scale up cervical cancer prevention programs. You can follow the links to lots of really useful technical documents. So these briefs are very short, but they will show you all the places you can get more information. And they're going to be relevant for lots of different stakeholders like health workers, government officials, and women's networks. And you can use them to advocate to the CCM for cervical cancer. Next slide. You can find these on our website at togetherforhealth.org. You can follow this whole link, or you can just go to togetherforhealth.org. And also wanted to thank all of our partners and the Global Fund for help in putting these together. We are almost at the end of time, but I did want to ask a question to each one of our participants. And I'll start with Dr. Furtado. I think the question is that if someone in a country wants to get cervical cancer funding for their program, what should they do? How should they get started in the country?
Thanks, Selena, for this great question. As I said in my presentation, there are key stakeholders in country that are critical to what we call the country dialogue. And I think it involves everyone, including technical partners, the CCMs, what we call the primary recipients, the Ministry of Health, technical partners, other stakeholders like the CSO, and those who are affected with HIV. And I think being very involved in the country dialogue to ensure that we have the right interventions, first of all, and that they're prioritized, costed, introduced, and also followed through implementation. So I think, though it's a very broad statement, I think that has been the critical success factor to ensuring even my colleagues from Zambia, Medhin and Mary Rose from Tanzania have shown that it is with advocacy that we actually managed to ensure that these are included.
Thank you so much. Dr. Medhin, do you have anything that you want to join with your experience as a CCM member?
Thank you very much. In Kenya, now we are also in the process of developing the Global Fund funding request for the next 3 years. And I'm again a CCM member in Kenya as well. So we are looking at now, the country dialogues, as Dr. Mentioned, Kutaza mentioned. So we'll see, what are really the gaps, because we are also finalizing the COP, the PEPFAR COP20. So I think we are trying to also look at, the alignment, the gaps that are not funded under the PEPFAR country operational plan, will be as much as possible addressed in the global fund. So it's just, we are just starting, and I'm hopeful that, this will also be included.
Great, thank you. And Mary Rose, is there any advice that you could offer to civil society, to others, to get involved in Global Fund?
So thank you so much, Selena. So in terms of advice for civil societies, I really wish they could, first step, I would have asked them to work very, very closely to the Ministry of Health, the specific department that coordinates cervical cancer prevention and control programs, so that they can align whichever they want to request with what really ministry wants to do. Because what we have realized and what the ministry doesn't want to see is implementing partner civil society coming in with programs that don't align with what is being recommended in the operational plan as well as in the country access strategic plan. And when you look at the operational plan and country strategic plans, when cervical cancer prevention control is concerned, most of them they align with what is actually recommended by WHO in different global evidence. So that's how I would advise to think of impactful intervention. We normally start with small things, really scattered, and probably don't align with really, really impactful results. So that would be my second advice. Third advice would be, I really wish civil service society would also focus more on a demand creation component, because when you look at what is happening in most of the African countries now, specifically the Ministry of Health, they can concentrate more on facility-based strengthening, but they don't do much when demand creation is concerned. So
Great.
civil societies can do much better work in that particular piece. Yeah.
Okay, well, that brings us to the end of our webinar. I want to thank very much our excellent speakers for really great, meaty presentations. We will be posting this onto our website so that you can go through their presentations in more detail. Thank you to everyone and to our co-sponsor, Friends of the Global Fight. Have a good rest of the day. Thank you.
Thank you
Thank you
so
very much.
Bye-bye.
Thank you. Goodbye. Have a good day.
Bye-bye. You too.